My scene is safe. I have my BSI on. I have an adult patient who needs airway support. I am going to select an OPA, confirm that it is the correct size by measuring from the corner of the mouth to the angle of the jaw. I am going to check this patient for a gag reflex with an eyelash flutter test. There is no gag reflex present, so I'm going to take my tongue depressor, position my airway, and I'm going to insert my OPA with a tongue depressor in the position of use. If I did not have a tongue depressor, I would insert it at a 90-degree angle and turn it around. My patient is now gagging, so I'm going to remove the OPA. I would consider placing this patient into the recovery position on his side as needed. I'm going to take my rigid Yankauer suction catheter, connect it to the tubing, turn on my suction device, and assure the presence of mechanical suction. Without suction engaged, I'm going to insert it into the oropharynx, engage suction, and begin to suction for no more than 15 seconds and no deeper than what I can see. I'm going to continue this until the patient's oropharynx and airway are clear. Now that it's clear, I'm going to insert an NPA. With the airway properly positioned, I'm going to select my NPA by measuring from the nose to the angle of the jaw. I'm going to lubricate this device as necessary, and then I'm going to insert it with the bevel towards the septum into the airway. I'm looking for any obstruction, skull fracture, and if I encounter major obstruction, I will not push through it, but simply continue in the other nostril.